Hi, it's Kylie with Punks for Progress. Did you know that 60% of the hospitals in the United States are non-profit hospitals? That sounds great. Sign me up. As a nurse, I've worked almost at all the hospitals I've worked at. I've seen poor patient care because of the profit-minded business models of the hospitals. I would love to work for a hospital that has no regard for profit making and relies on charitable contributions. Now, when I went back and looked at the 7 different hospitals I have worked at in the last 5 years, turns out all of them are nonprofit hospitals. Now, given what I just said about how they have poor business practices with regards to patients and care about profit, I wanted to dig a little deeper. So in this video, I'm going to expose the truth about nonprofit hospitals in America. So as I said, 60% of the hospitals in the United States are nonprofit and registered with the IRS as such, not having to pay federal income taxes, state income taxes, state sales taxes, local property taxes, and a few other taxes that have to do with lending and donations. And they are not paying these taxes in the good faith that the amount of money they would have put towards those taxes is actually going right back into the community. These tax breaks had an annual amount of about $24 billion. The most recent research I could find was for 2011. In 2011, those tax breaks equal about $24 billion that supposedly these nonprofit hospitals are putting back into the community. Now, you may already be savvy to the circus that can be nonprofits in America. Nonprofits are allowed to make profits. They're allowed to have surplus as long as that profit and surplus does not go to one owner or one private shareholder. Nonprofit hospitals get their distinction through the 501c3 section of the IRS code, which states to be tax exempt under section 501c3 of the Internal Revenue Code, an organization must be organized and operated exclusively for exempt purposes set forth in section 501c3, and none of its earnings may inure to any private shareholder or individual. Just for funsies and educational purposes, when we click on exempt purposes that are set forth by this code, these exempt purposes are charitable, religious, educational, scientific, literary, testing for public safety, fostering national or international amateur sports competitions, and preventing cruelty to children and animals. The term charitable is used in its generally accepted legal sense and includes relief of the poor, the distressed, or the underprivileged, advancement of religion, advancement of education or science, erecting or maintaining public buildings, monuments, or works, lessening the burdens of government, lessening neighborhood tensions, eliminating prejudice and discrimination, defending human and civil rights secured by law, and combating community deterioration and juvenile delinquency. So, back to our tax-exempt hospitals. At the time in the 1950s, when this IRS code was set up and put in place, there was little regulation for how hospitals reported back to the federal government as to why they deserve these tax breaks. And at that time in history, it might have been more appropriate because at that time, a lot of hospitals were run by the state, or they were run by nuns and priests who took and lived by a law of poverty. And there also wasn't as much technology to reinvest in at the time. But nowadays, hospital executives and administrators do not live by the law of poverty. And here are some of the recent salaries of CEOs of nonprofit hospitals. And I'll ask you, does it look like a lot of their profits are going to one individual or one private shareholder? These statistics are from around the years 2014, 2015. And they're made available to the public from their public tax filings. The CEO of Ascension Health, his total compensation for 1 year, $17.5 million. CEO of Northwell Health in New York, $10.1 million. CEO of Highmark Health, Pittsburgh, $9.7 million salary. CEO of Indiana University Health, $8.1 million. The CEO of Dignity Health, based in San Francisco, salary of $7.6 million. We have the former interim CEO of Trinity Health, based in Michigan, $5.7 million. And here are some more fun statistics. A study was done of the 82 largest nonprofit hospitals, and here are their top earners' compensations. 13 of those 82 nonprofit hospitals paid their top earner between $5 million and $21.6 million in 1 year. Of the 82 largest nonprofit hospitals, 61 of them paid their top executive between $1 million and $5 million in 1 year. And of those 82 nonprofit hospitals, there were 8 of them that paid their top earner less than $1 million, which proves it's possible to pay your CEO of your nonprofit less than $1 million a year. To hopefully be in compliance with that, hey, not all of our profits are going towards one person or one private shareholder. Let's look at more statistics. A study was done from 2005 to 2015 where the general salary of hospital CEOs was studied and compared to the general salary of nurses. So from 2005 to 2015, a 10-year period, the hospital CEO's annual salary was increased by 93%. And during that same time period for nurses, our salary increased by 3%. Also in that time frame, they looked at the annual bonuses of CEOs. From 2005 to 2015, the annual bonus of a CEO was about 33% of their base salary. I didn't say what nurses got, but I can tell you from my experience, I've never gotten an annual bonus from a hospital. So now let's talk about in what ways nonprofit hospitals give back to the community. In what ways do they deserve these tax breaks, these billions of dollars in tax breaks? And the equivalent to the tax break should be the community benefit. So the community benefit is the phrase I'm going to be using. So what community benefit does a nonprofit hospital give to its community? When you first think about it, you would think emergency services. Thank God hospitals exist for their emergency services. That's something that would not exist in the community without a hospital, without emergency services, without doctors. So is that a reason enough to give them tax breaks? That is something that they provide to the community. My answer to that is no. And federally, that is not a reason that they receive tax breaks. So according to a law enacted in the 1980s, which is referred to as EMTALA, it is the Emergency Medical Treatment and Labor Act. The federal law that requires hospital emergency departments to medically screen every patient who seeks emergency care and to stabilize or transfer those with medical emergencies regardless of health insurance status or ability to pay. And that applies to nonprofit hospitals, for-profit hospitals, religious hospitals, non-religious hospitals, trans-profit hospitals, however they want to classify themselves. They have to provide emergency services and stabilizing services to everyone that walks in their door. Therefore, that is not specific to nonprofit hospitals, so they don't get to count that as a community benefit. According to the IRS, there are 8 categories of community benefits that a nonprofit hospital must categorize its money distribution and can count that towards community benefits. These 8 categories were defined and they've been adjusted over the last few years, but initially with the Affordable Care Act. Previous to that, there was much looser regulations on what nonprofit hospitals could count as community benefit money. and report back to the IRS that they deserve that tax break. But the Affordable Care Act tried to implement some regulations. Let's go through these 8 categories, and I'll run through them real quick, and then I'll add my 2 cents into how I think it's BS, some of these categories, but we'll get to that. So number 1, charity care or financial assistance at cost. Charity care is a big one I'll get to in just a few minutes. Second category that a hospital can call a community benefit, unreimbursed costs from Medicaid. Number 3, unreimbursed costs from other means-tested programs, which is basically other insurances. Number 4, community health improvement services and operations. 5, unreimbursed health professions education. 6, unsubsidized health services that are not means-tested. I would call that unreimbursed costs from like financial aid programs. 7, unfunded research. 8, cash and in-kind contributions for community benefits. Okay, so let me go into a couple of these in detail and why, again, I think, and I've seen, a little bit of fudge numbers. So the first one, charity care. You would think that is when the hospital proactively knows that they will not get paid for a service or operation that a patient needs, and therefore uses a charitable donation from somebody else to pay for that. Sounds like charity care to me. Unfortunately, that is not the case. Hospitals are not that proactive. They do not have a fund set ahead of time of donations to go towards gallbladder removals or to go towards cancer treatments. They are always billing people, and they will hound you and hound you and hound you. And if after a certain time frame you don't pay them, then that will count as charity care to them, even if it is emergency services. So that's really unfortunate. In fact, you will see hospitals have very cute pamphlets and websites about financial aid and financial assistance for patients. But I will tell you, working at a hospital, when I look up the protocols and the budget summary and the definitions under the budget summary, I have seen charity care defined as unrecovered funds from billing patients. So they are not proactively thinking about you. They are not using charitable funds that they receive to pay for you proactively. So the second, the third, and the sixth, where they get unreimbursed costs from Medicaid, unreimbursed costs from other health insurances, and unreimbursed costs from other financial aid programs. So what's going on there? This is a very normal practice. Let's say you have the surgery, you need your gallbladder removed, and the hospital's telling you it costs $20,000, and you need to pay them $20,000 for them to take out your gallbladder. For a patient that has insurance, let's say Medicaid has already done their own research, their own means-tested programs, and they've decided that a gallbladder surgery shouldn't cost more than $12,500. So Medicaid is not going to pay your hospital $20,000 for your gallbladder surgery. They're going to pay them $12,500 because that's how much they think a gallbladder surgery costs. So your hospital, after you've received this gallbladder surgery that they have said is $20,000, Medicaid pays them $12,500. They get to count that $7,500 as charity care, as unrecovered funds, as a community benefit. So same thing with insurance companies, same thing with financial aid programs. When the hospital sets a certain number for a certain procedure or an operation or a treatment, and an insurance company doesn't pay that entirely, which again is a common practice, the hospital gets to count that towards something tax deductible. Number 5, unreimbursed health professions education. So to me, that sounds like when I have to go to my staff meetings or when I have to go to required trainings, and I get paid my hourly rate for going, it sounds like they get to count that towards a community benefit. Whereas for-profits have to pay their people that too, when there's required trainings, you would hope. Unfunded research, I guess that's a community benefit, but I'll get to that in just a minute, why I think that sometimes is bullcrap. So to me, the only legitimate categories are number 4, the community health improvement services, and number 8, cash and in-kind contributions for community benefit. Yeah. So a really big requirement for nonprofit hospitals by the federal government is that they conduct a community needs assessment. They don't necessarily have to do anything with it, but they need to conduct a study of their community needs. And so you would hope that number 4 and number 8, they're going to go towards those community needs that they find. So I want to close with my opinion of what I think the ideal nonprofit hospital should be, and really any hospital, the way it should be run. If they truly want to provide care to patients and wholesome care to the community. I think that patients' health and medical maintenance is largely based on stable income, stable housing, and stable access to providers, and stable access to their medications in order to have good health care. And I have a perfect example of this, of a patient I took care of last week, a man in his 50s who has heart failure. His heart does not pump as strong as someone who has a normal functioning heart. When your ventricle pumps out blood to the rest of your body, the amount of blood in there and the amount that it pumps out about 60% and refills. 60% of what it can contain and then refills. This man has heart failure and his ventricle is pumping out 5% each time it pumps. So that causes horrible shortness of breath. It causes swelling, and really a disruption of his activities of daily living and his ability to keep a job. Now, the hospital has put in tons of money into research into how to prevent people with his condition from being readmitted to the hospital. And so they come up with all these pamphlets and all these maintenance programs that the patient can do on their own to make sure they're being compliant with their medications and other recommendations from their doctors. And every time this man gets admitted for his inability to breathe and the swelling in his legs, he's given these pamphlets and re-educated on how he needs to be more compliant with his medications. So that's an example of how the community benefit is supposedly the research and the program that this patient is being provided. Now, when I actually talk to the patient and hear about his life, turns out this man is unfortunately a poor candidate for just any desk job, given just the way his life has turned out. And his most recent job opportunity was to work for the Department of Transportation, to stand out in 90 to 100 degree weather for 8 hours a day, flipping the road sign that says slow versus stop for cars. And he was so excited for this job because this man has not had a job or stable income for a while. So he took the job. And for 8 hours on a 99 degree weather day, he was out there flipping the sign back and forth, just grateful that he could have some income. Unfortunately, his heart, which was pumping out 5% each time it pumped, it couldn't handle that. And so he had to be admitted to the hospital, and likely he was going to lose his job because of this condition. So again, this person, as much research as we threw at him, needs a stable job or a stable income and stable housing so he doesn't have to worry about all the peripheral stuff to his heart failure, which is actually more important to him, that he has stable housing, that he has income to provide for whoever else depends on him, and for his standard of, so that he can have somewhat of a standard of living. So that's kind of my spiel about how social programs absolutely affect the health of communities, and hospitals need to be more invested in that. This has been Kylie for Punks for Progress, and thanks for watching.